Okay, let's talk about a really common pain procedure, facet joint radiofrequency ablation, or RFA. Now, if you're on Medicare, trying to figure out the cost can be, well, a total headache. So in this explainer, we are going to pull back the curtain on why that is, and more importantly, give you the exact questions to ask so you can get a straight answer and avoid those awful surprise bills. Have you ever felt this? You're looking at a bill for a procedure you've had before or one a friend had, and the price is just all over the map. It feels random, and it's incredibly frustrating. You are definitely not alone. And the CPT codes you see on paper, like 64635 and 64636, well, they really don't tell the whole story. But here is the good news. The real reason for these wild price swings is actually way simpler than the medical billing industry wants you to think. And in the next few minutes, I'm going to show you exactly what it is and how you can finally take control of the conversation. So, what's the big secret? What's the one thing that can change the cost so dramatically? It's not the doctor's skill. It's not the specific tools they use. It is simply where you get the procedure done. Seriously, it all comes down to the setting. And this chart really tells the whole story. Just look at this. On the low end, you have the doctor's office. In the middle, an ambulatory surgery center, or ASC. And then way up on the high end is the hospital outpatient department. The reason for that huge jump? One thing, facility fees. Let's break it down. A doctor's office, super simple billing, minimal extra fees. An ASC is a great middle ground, predictable, but it does have its own facility charge. But the hospital, that's where you can get hit with massive facility fees that can just blow up the total cost. So the key thing to remember is this. You're not just picking a doctor, you're picking a whole billing ecosystem that comes along with them. Okay, so now that we know the setting is the number one thing to watch out for, let's learn the language of the bill itself. Think of this as getting your secret decoder ring. This is how you empower yourself to ask the right questions and get a real estimate, not just some vague guess. First up is CPT code 64635. The easiest way to think about this one is as the base code. It's the starting point. It covers the work being done on the very first level of your spine that the doctor is treating. And right behind it, you have CPT 64636. This is the add-on code, and it's a multiplier. For every extra level they treat after the first one, they add one of these. So if your doctor works on, say, 3 levels, you're probably going to see that base code plus 2 units of this add-on code. And this right here, this is absolutely crucial. Any cost estimate that you get is basically worthless without knowing these 2 key multipliers. First, how many units or levels are they treating? And second, is it on one side, that's called unilateral, or both sides, which is bilateral? Because a quote for a single-side procedure can literally double if the plan is to treat both sides. This is probably the number one reason people get a surprise bill. All right, now for the most powerful part of this whole thing. We're going to take all this knowledge and turn it into a practical tool. I'm talking about a simple 7-question script you can use to get a real, reliable cost estimate from anyone, anytime. Here it is, your checklist for getting total clarity. Let's run through it real quick. Number 1, what are the exact CPT codes? You know them now. 2, how many units of each are we talking about? This nails down the multiplier. 3, is it unilateral or bilateral? Don't let that one slip by. 4, the big one. What is the setting? Office, ASC, or hospital? 5, can I get a separate estimate for the facility fee so you see all the pieces? 6, is sedation expected? Because that can be another charge. And finally, number 7, do you accept Medicare assignment? That's key. It means they agree to Medicare's price. Now, what if the person on the phone says, I don't know? Don't get frustrated. This is your magic phrase. You just calmly and politely say, no worries. Who is the best person to provide a written estimate with the units, laterality, and setting listed? It's a simple, non-confrontational way to get your request to the person who actually knows the answer. So you've learned the secret codes, you've got the script. Now let's see how this actually works in the real world. Let's walk through a quick story that shows just how incredibly powerful this knowledge can be. So imagine a retired teacher. She's been dealing with back pain for months, and she finally schedules her RFA procedure. The clinic tells her, don't worry, it's covered by Medicare. And like most of us, she hears covered and thinks affordable. That is such a common and dangerous misunderstanding. But the day before the appointment, her daughter just got this nagging feeling. Something didn't feel right. So she made one quick phone call. She asked a single, powerful question from our list. I just need to confirm, is this being done as a hospital outpatient procedure? There was a little pause on the other end of the line, and then a quiet, yes, it is. And you know what? That one question changed everything. They asked for a written estimate, they saw that huge hospital facility fee, and they asked if it was possible to move the procedure to an ASC instead. The clinic said, sure, that's totally fine from a clinical standpoint. The procedure itself was identical. The care was fantastic. But the financial stress, it just vanished. The family said it best. I didn't want a discount. I just wanted the bill to make sense. So think of this as your personal decision card, your cheat sheet. If your goal is to minimize those facility fees, the office setting is your best bet. If you want a really predictable environment, the ASC is a fantastic choice. And the hospital outpatient setting, you only choose that when your specific medical condition truly requires that level of care. The point is to make an intentional choice, not just go with the default. So let's just boil it all down. You now have 3 powerful levers you can pull to get a predictable bill. First, you have multiplier control. You will always demand to know the units and the laterality. Second, facility fee control. You are going to consciously choose your setting. And third, comparison control. You will always get a written estimate so you can actually compare your options apples to apples. See, you're not in the dark anymore. You have the language, you have the script, you have the strategy. You can get a clear, predictable bill for your healthcare. So the only question left is, now that you have the tools, what are you going to ask first?